Aloha and welcome to EWC Insights. I'm Jill Hamasaki, Marketing and Events Director here at the East West Center in Honolulu, Hawaii. I will be your host for today's special presentation, The Omicron Transformation, a Virus Ups Its Game. Thank you for joining us here on EWC Insights, where I welcome back my colleague, Dr. Tim Brown, Senior Fellow in the East West Center's Research Program. Dr. Brown's expertise in infectious disease modeling and its application to public policy has made him a highly sought after expert, thought leader, and especially on COVID-19. Today, he'll be sharing with us what we need to know about the Omicron variant and how to best protect ourselves, our loved ones, and our communities. At any time during this presentation, please feel free to submit your questions via the Q&A feature. Following the presentation, Dr. Brown has generously offered his time to stay past the hour and answer as many audience questions as possible. Please note, this webinar will be recorded and available for later viewing on East West Center's YouTube channel. And now, it's my pleasure to introduce our honored speaker, Dr. Tim Brown. Tim?
Thank you very much, Jill. It's a pleasure to be here. Let me go ahead and share my screen and let's get started. Okay. This afternoon, basically what I'd like to take people through is basically a detailed overview of the Omicron variant of COVID-19. Now let's start at the very beginning. What is Omicron? Well, obviously this political cartoonist, when he first heard of Omicron, immediately thought of the Transformers. And he basically did a cartoon that basically had COVID-19 basically transforming itself into a transformer. But in reality, what is Omicron? It is the latest variant of the SARS-CoV-2 virus. Now, what is different about Omicron from the previous variants is that it has massively transformed itself. It has about 50 mutations. Okay, so this compares, for example, the mutations on the spike protein for Delta, which is the variant we've all basically been living with for the last 3 to 4 months, and Omicron. You can see on the spike alone, there are anywhere from 30 to 36 different mutations, depending on who you talk to. There are actually several different sequences for Omicron, so there is some variation in what's seen out there. Omicron first came to global attention literally less than a month ago. Okay, it was basically, I believe, the day before Thanksgiving, November 24th, when the group in South Africa observed that there was a massive spike occurring in new cases. And in particular, this was focused in one particular province, Gauteng province, which is the most populated province in South Africa, but also the smallest one. It's the home to Johannesburg, Pretoria, several other large cities. And they saw an explosive growth of COVID cases in mid-November. And it was doubling about every 3.4 days. Now, this was a rate of growth that they hadn't seen before, even with their previous Delta wave. The Delta wave is seen here. Okay. So this rapid growth really caught them by surprise. And they looked into it, and because they have sequencing capacity, basically the genomic surveillance teams there basically sequenced this. And they found a new version of COVID that had an incredible number of mutations. They also were concerned that some of these mutations might lead to what we call immune escape. We'll talk a lot more about that later in the hour. So they reported it to WHO on November 24th, and November 26th convened an expert panel, and 2 days later declared it a variant of concern. They were that worried about it. Now, what was particularly concerning people at this point was they were seeing very rapid growth in a population that already had high levels of immunity. It's estimated over 70% of the people in Gauteng province were infected during the Delta spike. So basically, it was already a population that had a great deal of previous exposure to the virus and about 24% vaccination rates. So in this presentation, we're going to talk about this. And this is all relatively new information because literally this has all come out in the last month. We're going to explore what does Omicron change about COVID and why. We'll focus on the rapid rates of spread, the immune breakthroughs that we're seeing, the large cluster outbreaks that Omicron is producing, and some of the issues around severity that you see discussed in the press quite a bit. And then toward the end of the presentation, we'll focus on what can we do about it. What are the implications of Omicron for the tools that we use to prevent COVID transmission, and how will we keep our families safe from Omicron? And again, I want to stress, this is very early data. This is all things that have been developed literally in the last 3 to 4 weeks. And so it will be firmed up. Some of it may change, but I think we have a good initial picture that helps us to understand the characteristics of the virus that we're seeing. Now, let's start by talking about its rapid spread and growth. This is a map that's been made from the sequences that are submitted to a site called GISAID that collects genomic sequences for these viruses. And this shows you the interconnections between different countries in the world that have been observed within that database. By looking at they reconstruct the tree, the ancestral tree, if you will, of the virus, they can tell where a particular strain came from originally. That is, what's the interconnection geographically. And as you can see, there are massive interconnections on a global scale. And all of this, again, has happened in the last month. At last count, and this is no doubt out of date, yesterday, I believe we had 89 countries that had reported Omicron, and we had 45 states in the United States that had reported it. Those numbers are almost certainly higher today. Now, what's been observed in countries where they actually do sequence a large number of their samples of COVID is that we're seeing exponential growth of Omicron. Okay, so for example, in Scotland, you can see this started slow. And again, no, this is basically November 24th. So we're talking basically Thanksgiving our time. Started very, very slow, started growing, and exponential growth. Same thing in Denmark has been observed. This is the data through the 15th. Again, you can see it started very small. As of yesterday, this is the latest data that they had available because it takes several days to do these sequences. So the latest data is the 15th. They were already at 46% of all of their COVID cases were Omicron. So this thing is spreading incredibly fast, much faster than anything we saw before, including Delta. And where we do have good sequencing data to track this, we've seen the same sort of growth. Okay, these are on what we call an exponential scale. We basically take the logarithm values here. But when we get a straight line here, what it represents is that exponential growth that I described. And so you can see here in very diverse countries, Germany, the UK, the US, and South Africa. In all of these countries, we are seeing this exponential growth of Omicron. It is on track for world domination. This shows you basically those same countries. And this shows the rate at which the percent of all of the confirmed COVID cases that are Omicron. And so you can see it is rising literally exponentially. And we are anticipating that probably by January in all of these countries, Omicron will be completely dominant in the epidemic. That is, virtually all of the transmission will be Omicron. In the real world, that sort of spread translates to exponential growth. And we're seeing that. This just shows you the numbers in Denmark, United Kingdom, Norway, South Africa. Now, South Africa appears to have turned the curve. But again, we don't know to what extent this may be related to some limitations in testing capacity, or also it may just be that they have a highly previously infected population that may reduce the number of people able to be infected. But in all of these countries, we saw this very rapid exponential growth. So that is a characteristic of Omicron. It's something we're seeing in most places where it is spreading. The problem is in most places we can't track it because most countries don't do a particularly good job of sequencing data. Now, the other thing I want you to note about these countries is all of them, for the most part, are much more vaccinated than the US. The US, we're here at about 60, 61, 62%. United Kingdom, Norway are close to 70. Denmark's up around 74. Okay. So Denmark is actually similar to the levels of vaccination that we actually see here in Hawaii. So despite the fact that they have heavily vaccinated populations, we are still seeing this sort of exponential growth. So that's a real concern. Okay. Now in South Africa, while the vaccination is low, we had, as I mentioned, over 70% of the population was infected in the previous Delta wave. So again, we've got a lot of people with pre-existing immunity from a previous Delta exposure, but that doesn't appear to have stopped the spread of this particular variant. On a local basis, if we go down to, say, the city level, we see even more rapid and apparent growth. This is London, okay, where again, the UK sequences a lot of their data. Okay, this is Delta, this blue curve. So the blue curve here is Delta. The red curve is Omicron. So you can see Delta continued being transmitted, but Omicron is rapidly taking over, and Delta is on a bit of a decline now. We don't know if this will go down to 0 or not. We're waiting to see. But Omicron definitely is outcompeting Delta, spreading much, much more rapidly. And this is occurring across the UK. This shows you the other parts of the United Kingdom. And you can see London was the first, but the other parts of the country are now starting to come up very, very rapidly with Omicron. Okay, so again, it's getting a later start in these parts of the country relative to London, but it is nonetheless rising exponentially just as it did in London. This is not the only place where this is happening. It turns out San Diego actually does a pretty good job of sequencing data. And this shows you the rate of growth of Omicron in San Diego. So basically, we're looking at December 20th, we basically passed about the 50% point. Okay. And basically by Christmas, they're pretty much going to be at 100% Omicron in San Diego. Okay, so this thing is spreading incredibly fast. In fact, they give you the doubling time here. What they're seeing is a doubling time of 1.3 days. That is, the number of infections is doubling literally in less than 2 days. Now, on a national basis in the US, we're seeing very much the same picture. Okay? This is the actual sequencing data that CDC just uploaded yesterday. Okay? And you can see this is the week ending December 4th. And at that point, we had 0.7% Omicron. This is the next week. At that point, we were now up to about, I believe, 13% Omicron. And the following week, which is this week, we're at 73.2% Omicron. So Omicron has literally swept across the United States. And you can see that in this figure. The purple here is Omicron. The orange is Delta. And you can see that Delta is basically now getting crowded out by Omicron. It's rapidly taking over the United States in terms of spread. Now, the other thing I want you to note about this here in the US is to compare the rate of spread of Omicron with Alpha and Delta. Okay. So here you can see the brownish here is basically Alpha, which was the variant that started spreading in the UK last Christmas. And fundamentally, in the United States, it started showing up at significant levels in early February. So by mid-February, basically we were seeing a little bit, probably about 5-6%. But then over the next 3 months, basically through May, it grew to the point where it was now almost 75% of cases in the United States. But its position on top in the United States didn't last very long because along came Delta. Okay, Delta is this slightly darker orange here. Okay, and what it did then, you can see here, Delta is just starting. It's growing, getting bigger. And by end of July, it pretty much had taken over in the United States as well. So it had forced Alpha out and pretty much had taken over. Now, one thing I want you to notice about these two pictures, these are based on 2-week intervals. So this is the sequences in the preceding 2 weeks. Now, this is the figure for Omicron, but there's a change in the CDC graph this time. This is the data for 1 week. So where each one of these represents a difference of 2 weeks, each one of these is just 1 week. And so we went from basically virtually none, I think it was 0.3% or something here. We jumped up to about 12 or 13%. And now we're at, 12.6%. And now we're at 73.2% in the United States as of the week ending December 18th. Now, again, the sequencing data is running behind the actual picture because it takes time to get these sequences done. So we are actually higher than 73% Omicron in the United States right now. Now, if we want to do a comparative picture of the spread of Omicron versus Delta, one of the easiest ways is to actually go and graph up the different waves of the epidemic on the same scale. Okay, so this is showing you the COVID cases in Gauteng province, South Africa, the place where we first observed the rapid spread of Omicron. And you can see the Omicron wave goes up much, much faster than the Delta wave, which is this blue line. So Omicron is spreading much more quickly than Delta did. And we saw that in this diagram as well, right? It took much longer for Delta to take over, whereas Omicron has literally taken over in a matter of about 2 weeks. Now, unfortunately, the city and county of Honolulu looks very much like this. This is the current spike in seven-day average number of new cases reported in Honolulu. And I took that piece of the curve, I reproduced it, and I shifted it backwards so you can see basically how it compares with the Delta wave back in July. And you can see it is rising much, much more rapidly. It also shows no signs of being near the peak, and yet we are getting very close to what the Delta peak looked like. So Omicron is spreading much, much more rapidly than Delta with it and will spread to higher levels. So I think that's an absolutely critical thing to keep in mind as we go forward. Now, I want to stress that Omicron is the 5th variant that has grown to global dominance. We started with the original Wuhan strain. We then had the D614G variants, which I described in my previous presentation in August. We then had Alpha, starting last Christmas. We had Delta, starting in April in India. And then we have Omicron, which basically got started about a month ago, maybe a month and a half ago. I think the genetic people are saying that probably the spread actually began about mid-October. So this one literally has been in the field for only 2 months at this point, and yet it has rapidly come to the point where it is outcompeting Delta. And the question is, how is it doing that? Is it actually more transmissible than Delta? Which would be very frightening because we already pointed out before that Delta has an R0 of 6, which means if no interventions are in place, the average person would infect about 6 others. So is Omicron even worse than that? That's an open question at this point. Or is there also something else operating here? And the first hints that we get that something else is operating here is the fact that it is growing so rapidly in heavily vaccinated countries and populations that have had a lot of exposure to COVID in the past, like South Africa. That indicates that something else is going on just beyond higher transmissibility. So what is it? Well, what it is immune escape. Okay? It's the mutations. They basically have changed the behavior of this virus in a way that has weakened the tools that we have basically to protect ourselves. So we're very early on. We haven't had time to do the studies in humans very well at this point to determine what's actually going on with this, how rapidly it infects people, and so on. But what we have had time to do is what we call neutralization studies in test tubes. What they do here is they take blood from people who have either had one of the previous variants, have had vaccination. This vaccination is a double Pfizer vaccine. And what they do is in the test tube, they see what it takes to infect cells. How high do they actually have to raise the virus level before the cells get infected? And that gives you an indication of how effectively you're protected. So if these curves are high, you've got pretty good protection. That is, your antibodies are protecting you against infection. If these curves are low, as they tend to be with a double Pfizer vaccine, then we got a problem. Okay, that means our vaccine is nowhere near as effective. This is for somebody who had Alpha. And you can see their protection is exceedingly low. So a previous infection with alpha is not very protective against the Omicron variant. So there have been large number of studies. At this point, I believe there are 8 or 9 different neutralization studies are out there. They have all reached pretty much the same conclusions. There is substantially reduced protection from a 2-dose Pfizer vaccine, and it wanes to about 0 protection at 6 months. Okay, similar results have also been seen, early results for Moderna vaccines as well. There is very little, if any, protection from prior infection with either alpha or delta. So again, this is like a delta pre-infection, and you can see again, very little neutralization here. There is good protection for those who got infected first and then vaxxed, or those who got vaccinated and then infected. That's what they're calling super immune now. Those people who had an early infection and then got vaccinated afterwards, they basically have relatively high levels of neutralization, even against the Omicron variant. So fundamentally, if you were infected and then got vaccinated, you're probably in a pretty good position right now in terms of your ability to deal with Omicron and protect yourself against Omicron. Now, this has been done across a whole range of vaccines at this point, and fundamentally what we're finding is the vaccine's effectiveness is dropping radically. Okay, these 44 times numbers are the drop relative to the original D614G strains, and it shows you that your neutralization, the ability of your antibodies to combat it, is down by a factor of 44 with double dose Pfizer, down by a factor of 36 with double dose AstraZeneca. It's down exceedingly low with J&J's. The J&J vaccine is not giving us very good protection at all at this point against infection. And these are then the Chinese and the Russian vaccines, again, also severely impacted by Omicron. So Omicron is basically working its way around our vaccines in the test tube. And that's a real issue. Now, there are results for the boosters. That is, if you get your 3rd shot of Pfizer or a 3rd shot of Moderna, or even if you mix them, it doesn't matter. We're finding that basically that's getting your protection back up to very, very high levels. Okay, so this is boosted Pfizer, and you can see the neutralization is now back up similar to the levels that we had with the previous variants. Okay, so once you get boosted, you're getting very, very good protection then against infection, about the same level that you got with Delta before. So it's worth noting that these are positive findings, and that it tells us that boosting basically can give us additional protection against infection with the virus. But at this point, again, these are still comparatively small numbers of samples, and there will be more data coming in over the next several weeks. But positive indications that boosting is a good thing, and that it gets us back up where we need to be. Now, there are 2 studies at this point that have actually looked at real-world reductions in vaccine protection against infection. The first was done in the United Kingdom, and that's shown here. And you can see this is the time since your 2nd dose in weeks. This is if you got the booster. And the squares are Delta protection, and the circles are Omicron protection. So you can see what happens. If you have 2 doses of Pfizer, immediately after you get your doses, you have almost the same protection you had against Delta. But after several weeks, after 2 months or so, basically it starts to wane and it drops down to about the 35% level or so. If you're boosted, it gets back up to about the 75% level. So basically what we're finding is when we look at protection of your vaccines against infection, a Pfizer 2-dose, if you are not boosted, is only going to be about 35% effective against getting you infected. If you get your booster, it will be about 75% effective. And we expect the same thing to happen with Moderna, but the Moderna data is literally only coming out in the last couple of days. So fundamentally, our vaccines are less effective in protecting us against infection. There was another study done in South Africa which found almost the same results. This was the real world protection of the Pfizer vaccine against infection pre-Omicron for the Delta wave, basically. It was about 80%. With the Omicron wave, it's dropped to about 33%, which agrees fairly well with the 35% or so that they were finding in the UK. They also found, they also found that it was waning over time. So your protection against infection was dropping the further you were away from your second dose. Okay, again, stressing the importance of getting boosted. The other thing that they looked at, they did look at reducing hospitalizations. And what they found was that with the Delta wave pre-Omicron, they basically found that the Pfizer vaccine was about 93% effective against hospitalization. Whereas with Omicron, that dropped to about 70%. So you're still getting a lot of protection, 70%, but there is still some possibility of hospitalization. And we'll talk in a couple of minutes about how severe that illness is likely to be. So there is a reduction in the effectiveness of our vaccines against hospital admissions, but in practice, it seems to be holding up fairly well. Now, the other concern that we've got is many of you are aware that we use monoclonal antibodies as a kind of last resort when somebody gets infected. If we can test them early and then get them on monoclonal antibodies, that's very effective at reducing severe illness. But the problem is the neutralization studies are finding that many of the monoclonal antibodies we use are not working very well. This blue line is Omicron. And again, high curves here mean you're working very effectively against the variant. Low curves mean you're having very little impact on it. So what we find is many of our monoclonal antibodies have effectively become failures against Omicron. So they're not going to work very effectively in preventing illness with Omicron. There are a handful that have retained efficacy, although at somewhat reduced levels generally. But again, that means we've got to re-gear what monoclonal antibodies we're using. Now, there is a real bright spot, and that is the pill treatment that Pfizer is coming up with called Paxlovid, which has not, unfortunately, yet been approved by the FDA, although it's been approved in Europe and is being rolled out there now. That has been found to cut the risk of hospitalization or death by about 90%. So that's an extremely effective treatment if we can just get it out there. But right now we're held up basically by the FDA. And when they get it, then we basically have to roll it out, get the supply lines geared up and so on. So it will take some time. Now, the good news is that the T cell memory is holding up very well. Antibodies in the initial phases basically are what prevents you from getting infected, but it's the T cells that do the heavy lifting and really mount the immune response within your body once the virus gets in. And those are far less affected by immune escape in the preliminary studies that have been done. So here you can see reductions are comparatively small. Okay, so what we can expect from this is that our T cell immunity is holding fairly well. And that means that we will probably still be largely protected against serious illness and death if we're vaccinated or previously infected. And this is supported by the observations of many of the people. Most of the people that we've actually found with Omicron were vaccinated beforehand or had a previous infection. So we are seeing relatively mild illness with most of these people. So that's good news that our T cell response is going to really hold up and our vaccinations will protect us against serious illness to the greatest extent. Now, we are at the very early phases of understanding why this thing infects so easily. One finding, this is a study from Hong Kong where they actually took tissue samples from the bronchus, basically the windpipe, if you will. And what they find is that Omicron spreads about 70 times faster in these tissue samples than Delta did. Okay? So Omicron has a definite advantage there in spreading. But the good news is it seems to spread more slowly in lung tissue, which is where the serious damage is done by this. And this has also been backed up by another study now, which I haven't repeated here, that shows that we're seeing less infection of lung tissue by Omicron. So that may contribute to reducing some of the damage that Omicron will do going forward. But again, these are test tube studies at this point, and we really need to see what happens in people. Skip that one. Now, the other feature that we are seeing, so we've got two features now. We're seeing very rapid transmission. We're seeing immune escape, so that our vaccines, unless we get boosted, are not being anywhere near as protective as they were before against infection. And what this is giving us is very large cluster outbreaks with Omicron. And it's really important to understand this because This is part of the reason why we have to be extremely cautious this holiday season. This is one example that's been extremely well investigated. This was a Christmas party in Norway. There were 117 attendees at this Christmas party. 96% of them were double vaxxed between May and November of 2021. None of them were boosted. And they were all asked to self-test 1 to 3 days before the party. So they came to this party, and basically at that party, 74% of those who were interviewed, 111 out of 117, 74% of them became infected with Omicron. There's only one Delta infection they've detected there so far. The rest was Omicron. And to make matters worse, that was the people who went to the Christmas party. But at the same restaurant that night, 70 other people who were not part of the party basically also became infected with Omicron. So this is a massive outbreak. This shows how extremely contagious Omicron can be, even in vaccinated populations. And these are not exceptions. Okay, there's a new website called Corona Locator World, which is trying to start collecting data. This is the web link if you want to go look for it. And they're trying to collect data on these types of outbreaks. So this shows the map of the ones they've collected so far in different countries and different places. And what you can see is, they're everywhere. Down in Australia, in the US, Europe, some in Asia now. And these are the types of events that are basically leading to those outbreaks. Events and parties are right at the top of the list. Schools and daycare are second. And then we've got churches, catering, sports clubs, hospital settings, definitely an issue. So basically, we are seeing spread of Omicron in clusters in a large number of different types of settings. And that's really worrying. Cornell University just last week basically shut down over a major outbreak. On Friday night, they announced that they had, I think, 184 cases detected. Over the weekend, they said 300. By Monday, they were basically reporting over 900 COVID cases among their students. And they shut the university down, went online for finals. We are also seeing clusters in places that are relevant to our responses here in Hawaii. For example, restaurants with vaccine requirements. That's seen in multiple locations in Europe. Christmas parties are an extremely common cause. So let that be a warning to everybody. Cruise ships are showing up. The latest case being the one that was announced yesterday with 48 positive cases on a cruise ship where, again, people were largely vaxxed, but they were mingling. There was a wedding in Wisconsin where a bunch of healthcare workers went from Oakland, California, and so far 11 of them got infected with Omicron, even though they were all vaxxed, but they were mingling at the wedding. So weddings are a possibility. Nightclubs, we've seen that. This is New South Wales, Sydney, and we've also seen that, of course, in Honolulu. We've had at least 2 major outbreaks in nightclubs here in Honolulu just in the last week. And then indoor climbing gyms. So the types of settings that can spread Omicron are pretty much the types of settings that many of us go to on a regular basis if we're not particularly worried about COVID. Now, I want to address issues around severity because this is getting a lot of press. And I want to stress right at the start, it is far too early for us to conclude that there is lesser severity for Omicron among those who are unvaxxed and not previously exposed to a coronavirus. Certainly, I would say the evidence is fairly strong at this point that if you had your vaccines, even the double dose, and you basically were exposed to COVID or, were infected with COVID before, you probably do have significant T cell immunity, so you're probably protected against severe illness and death in most cases. Although there are exceptions for that, for example, among people who are older and may have other underlying conditions such as diabetes or high blood pressure. But in general, those people seem to be, if you're not in those categories, you seem to be having lower risk of severe illness. But with that said, it's been postulated that there aren't a whole lot of hospitalizations going on here. But I want to show you the actual data for hospitalizations from Gauteng. They actually collect this data on a regular basis. You can see, basically, the mid-November is when Omicron started to spread in Gauteng, and you can see their hospitalizations have climbed. They're starting to fall now, but again, there is some reporting delay here, so these numbers will probably go higher toward the end of this week. But it's interesting. If I actually compare the total number of cases of COVID that have been detected in Gauteng and compare that to the number of hospitalizations, at some point, about 4.9% of all people have been hospitalized. That is, I should say, of all cases. Now, the cases will not capture everybody. There will be asymptomatic infections that are not captured, the people who did not go to test. But nonetheless, it is concerning. There is still a growth of hospitalizations that is associated with the Omicron wave. And this is in a population where most of the people probably had a Delta infection 2 or 3 months ago. Now, what we are seeing, if we compare the Delta wave with the current wave, and this is showing the ratio of the cases to what they were at the Delta wave. So right now, the cases are very close to the peak of the Delta wave at about 100%. Hospital admissions are running about half the level they were with the Delta wave in South Africa. And in fact, the study I mentioned earlier that looked at vaccines also looked at hospitalizations. And what they found was there were about 29% fewer hospitalizations with Omicron compared to the earliest wave. They weren't looking at Delta, they were looking at the earliest wave, the D614G wave back last year. And so they found fewer hospitalizations compared to that wave. But worryingly, they did find slightly higher hospitalizations among children. But again, this is preliminary data, so we really need to back this up with a lot of information from other places. But that data will be rolling in over the next several weeks. Hospitalizations in London, I showed you the graph for London's Omicron surge earlier. Hospitalizations in London are also climbing. And the Financial Times, John Byrne Murdoch there basically has been comparing the rate of growth of the current surge, which is the Omicron surge, with the summer surge, which is Delta. And we're seeing the rate of growth of those admitted for COVID is growing at about the same rate as they saw with Delta. So that is concerning. If we saw a significant number of hospitalizations with Delta, we may continue to see that with Omicron. So that's very worrying for us here in Hawaii, where we have comparatively limited hospital capacity. Now, what is giving rise to this lesser severity meme that you're seeing throughout the major mainstream media? It's basically the immune wall. If we look at the UK, virtually everybody in the UK has been dosed with at least one dose, been previously infected, or are pretty much fully vaccinated. Okay? There's only a sliver of people who are immunonaive, who basically haven't been exposed to either the vaccine or to a previous virus. And like I say, because your T cell response seems to be holding up fairly well, that's what's leading to these messages that we don't have to worry about it. But the problem is we have no idea of what happens to the immunonaive, those who've never been vaccinated or never been exposed. We have no idea at this point whether it will be any better or worse than previous variants of the virus. So what can we do about Omicron here in Hawaii? I think the first thing is to realize that you're not helpless. There is a lot that we can do basically to control the Omicron surge here. Let's start by just quickly reviewing the implications of what we learned. First of all, Omicron has changed the immune landscape. Our vaccines are now less effective against infection, and boosters are critical basically to getting our protection against infection back up again. Also, a previous infection alone will not stop Omicron. And that means we can't rely on vaccines alone to stop this. We have to use other measures. Omicron is as or more transmissible than Delta. That means we're going to see large clusters in unregulated indoor settings without masking. And we're already seeing that in Honolulu and the nightclubs, and I'm certain it's happening in the restaurants as well. And any large events basically can turn into super spreader events. And the rate of growth of Omicron will almost certainly exceed the previous Delta spike. And finally, it has reduced the efficacy of many of our monoclonal antibodies. So our first line treatment is now reduced in terms of availability. There are 2 that seem to retain efficiency, but there are limited supplies of those in the United States right now. So that's a real issue. Paxlovid, the miracle pill that will probably protect about 90% if you get it early, basically has not been approved by the FDA yet. So what's our situation here in Hawaii? I want to review that quickly before I talk about what we can do. First of all, I want to stress we have not yet recovered from the Delta spike. We still have people dying. We're still getting 3 to 5 deaths being reported every other day or so. And those are basically holdovers pretty much from the earlier Delta wave. So we have not recovered from that. The other thing I want to stress here, notice where those deaths have been occurring. The highest rate of death is among people above age 60. In fact, 2/3 of all deaths in Hawaii in the last 6 months, basically since the Delta wave, have been in people over age 60. So that's a real concern. Age is a major risk factor here, and we need to keep that in mind. This is the 7-day average of cases for Oahu. And as you can see, we are in an exponential rise at this point. These last number of pairs probably underestimated a bit because these are weekend numbers, and weekend numbers are always a little bit lower. So we are definitely seeing a major rise. I showed you this graph before, but I want to stress this. This is how the rate of increase in the current epidemic, which is almost certainly Omicron. Don't really pay attention to the fact, oh, we've only detected 50 Omicron. Believe me, this is Omicron. We do not see this rate of growth with Delta compared to our Delta surge. So you can see this is growing, and we are almost, probably tomorrow, we will exceed the peak of the previous wave, the Delta wave, and we will continue up from that point. So we are in a very serious situation in terms of the rate at which this is spreading. And on Oahu, we're not alone. This is now starting to occur on each of the neighbor islands, the Big Island, Hawaii, Maui. Okay, so this thing is underway on an island-wide, or I should say a statewide basis at this point. So what can you do to protect yourself, your ohana, and your community? First, accept that there's no magic bullet. Do not think that your vaccine alone is going to protect you from infection or protect those around you. We need to use multi-layered protection. And I really want to stress that here. Okay, there are a whole lot of different things we can do. Masking is a first line of defense. Staying home if you're sick is critical. And we know a lot of people are not doing that. Testing and tracing. If you got any symptoms, get yourself tested. And vaccines, of course, getting boosted. So these are the things I would recommend that you and your family, actions that you should take immediately. First of all, if you're not boosted yet, get your booster shot. Omicron weakens your vaccine protection. And as this graph from Nature shows, we basically are seeing reduced protection against infection with all of the different vaccines. Up your masking game. Omicron is much more easily transmitted than even the Delta variant. So that means just using your lousy bandana or your cloth mask is probably not enough anymore. You really should be moving to N95s or KN95s, these types of masks, which will give you much better protection, will give you a better seal on your face. They'll keep you from coughing virus out. They will also protect you against virus coming in. If you can't get your hands on these, sometimes they are hard to find, double mask with the surgical mask and put the cloth mask over the top of it. Okay, that's not as effective as these masks, but it's a good alternative and it's much more effective than simple cloth mask or bandanas. Avoid crowds. Okay, Omicron spreads extremely rapidly in such settings. And this is the Republic nightclub last weekend. And this is where we've now detected 30 cases. There are certainly a lot more. You see virtually, it's like playing Where's Elmo if you try to find somebody in this picture who's actually wearing a mask. There's a few down front, but there aren't many. And they're yelling and screaming their lungs out, which we know is guaranteed with the respiratory pathogen to spread it all over the place. You do not want to be in these settings. I would also recommend caution in going to restaurants. Do takeout. It's a lot safer. Sitting in a room for 1 or 2 hours with a lot of people who are not wearing masks is not a good idea at this point in time. Remember that our kapuna are still at high risk. Breakthrough hospitalizations are largely among those who are older. This is data for the US as a whole, because unfortunately we don't have the full data for Hawaii that we can get access to. But among those who are fully vaccinated, fully 69% of the breakthrough infections were in those 65 and older. Okay, your immune system gets weaker as you get older, and so you are more likely to get infected. Remember, 2/3 of our deaths in Hawaii in the last 6 months have been in those 60 years of age or older. and take appropriate precautions to protect your kapuna. Improve the ventilation in your homes and workplaces. Open the doors and windows. Use fans. Get HEPA air filters. You can buy these relatively cheaply on Amazon if you want. If you have any symptoms or exposure, test. Rapid tests are just fine, but you probably should repeat them after a couple of days. The reason they package these in two is they recommend you test immediately and then test again 2 or 3 days later. And that way you'll probably pick up most of the infections. But if you're going into a party or something, you should test immediately before the party, not the day before. Because we have some evidence that with Omicron, your level of virus grows more rapidly than it did with the previous variants. And please, gather safely for the holidays. If you can go outdoors, do it. This is Hawaii. We got beautiful weather. Go to the backyard. Basically hold it out on the lanai somewhere. It's a lot safer that way. If you are indoors, try to ventilate. Use rapid tests before these gatherings, not 1 or 2 days before. Use them at the door. Okay, as somebody walks in the door, hand them a rapid test. Have them wait outside for the 15 minutes until the test result comes back. If it's clear, then they can come in. Don't do it 1 or 2 days before because they may have developed infectious virus during that period of time. If you have any mild illness, do not attend this. And if there are vulnerable members in your family, absolutely mask. You need to protect them. Now, there are a whole lot of other actions that our leaders should be seriously considering. They've been very slow to react to this. First, they should immediately pull the circuit breaker on group spread. They should launch a targeted booster campaign. Okay? Have our health providers basically reach out to everybody who's above age 60 who's not boosted yet and get them boosted. They should empower people to protect themselves. They should launch an immediate public messaging campaign to educate people on how contagious Omicron is and how rapidly it's spreading in the community. They should obtain and distribute high quality masks to everybody for free. They should expand our testing capacity and start providing rapid tests at little or no cost to anyone who needs them. And they should keep the quarantine facilities that we know they are now in the process of shutting down. That's a huge mistake. So it's critical that we improve and it's also critical that we improve our data system so that we can give people a clearer picture. I can't give you data on the vaccinated, unvaccinated status of those older people who got infected here because that data is not available in our systems. And finally, they need to anticipate the future and prepare for what's to come. They need to increase our monoclonal antibody capacity. They've got to prepare our hospitals for a major surge. Even if there is lesser hospitalization, even if it's half the hospitalizations, if this thing grows at 2 to 3 times the rate of Delta, then our hospitals will still get overwhelmed. And remember, we don't have much hospital capacity here in the islands. And finally, we should be thinking about expanding the Safe Travels program to include a 24-hour pretest and boosting as the vaccine requirement. And finally, we should work to mandate improved ventilation in workspaces because a lot of infections are now being reported from workplaces and so on because Omicron is that much more infectious. So what I want to leave you with is that we all need to get ahead of the virus for a change. We're playing catch up again. Now, this is ridiculous because this is like the second time, frankly, we've been caught with our pants down. Okay, we got caught by Delta, even though people told us it was coming. We knew it was coming. We watched it spread in other countries. We didn't do anything about it. We did that again with Omicron. Okay, the data was there. We knew that we should have done something 2 weeks ago, but basically, we basically lifted all the restrictions basically on December 1st, which is exactly the wrong time to do that. But I think because our leaders are behind it, it's up to us, the people, basically to lead. We basically need to take the steps that I've outlined here to protect ourselves and basically to keep our community safe, to keep our kapuna safe, and to keep Hawaii safe. And with that, I'll throw it open to questions and turn it back to Jill. Thank you.
Tim, thank you so much for that informative presentation. We have a bunch of questions for you, so we'll just jump right into that. Start taking questions from the audience. Just a reminder to our attendees, please submit your questions through the Q&A feature. And our first question for you, Tim, Is it possible that the COVID vaccine has accelerated the mutation of the virus? Or did the mutation occur in other countries or regions, but South Africa was just the first to report it?
Uh, Fundamentally, I mean, we only have hypotheses about this at this point. But the current hypothesis is that probably Omicron developed in somebody who was immunocompromised, possibly a person with HIV who basically was not on antiretroviral treatment. So their immune system was weak. In those circumstances, basically, they can get infected. And the infection lasts a long time, which gives the virus a lot of time to mutate within the body. And so that's what we're hypothesizing is probably the cause. Now, that makes it likely that it may have developed in Africa because we do have a lot of untreated HIV in many countries.
Mhm.
But with that said, there is absolutely nothing that would keep the virus from eventually starting to move around our vaccines anyway. Omicron was probably not trying to avoid our vaccines, but it just made so many mutations that it effectively found its way to avoid them. And then it had a competitive advantage over Delta, so basically it spread like crazy. So, I mean, no, the vaccines themselves are probably not driving mutation at this point. It's the fact that we haven't vaccinated most of the world that is driving mutations because we're allowing the virus to spread freely. At this point, only about 40% of the world is fully vaccinated. And that's a real shame because it means the other 60% is basically fair game for the virus to evolve.
Mhm. Thank you. Tim, could you discuss mutations and severity? Drawing on historical data, is there any indication that viral mutations become less or more severe over time, or do mutations happen intermittently?
Okay, let me first address the myth that all viruses evolve toward lower virulence. That is, they cause less serious illness as they evolve. Smallpox was around for a very, very long time, hundreds and hundreds of years, and it never evolved to become a harmless pathogen. Okay, so this is a fiction that a lot of people like to put out there that everything always evolves that way. Now, it may have happened that way with some of the previous coronaviruses. They may have been more severe in the earlier days, and they may have evolved to lower virulence, and now they cause common colds. But we don't know with this particular virus. This virus is different than those viruses in that it front loads its infections during the asymptomatic period.
Mhm.
Okay, that is something that is extremely unique to SARS-CoV-2. The other coronaviruses, basically, you're pretty much symptomatic before you start spreading. With SARS-CoV-2, we know that probably 50% of the transmission is occurring before you become symptomatic. That's what makes it so hard to stop this thing, right?
Mhm.
So that also means there is actually no competitive advantage to it to not kill its host because it's doing most of its spreading before the host dies.
Right.
So there's actually not much advantage to it to become less virulent. So I think, it's a fiction that they will become less, but we don't know that at this point. And, we can hope that this one has become less virulent, but again, it may just be luck of the draw in this case because so many mutations occurred that it may have reduced the virulence. But we don't know yet. And again, I want to say we do not have any samples for
Mhm.
people who are not vaccinated or previously infected of any size that we can say what the level of illness is going to be there. And I remind you, 40% of the American population is unvaccinated. Okay? Those people are in big trouble right now, as President Biden said this morning.
Thank you, Tim. In light of the decreased effectiveness of the vaccines, how soon after the second shot should people get a booster? Should they still wait 6 months?
Right now in the US, you don't have too much option because CDC specifies 6 months. Many countries are now moving to a 3-month period because the waning, your protection seems to be fairly high for those first 3 months, and then it starts to drop off.
Mhm.
Okay, so UK, for example, now, Boris Johnson has pulled out all the stops. He has asked the National Health Service to boost everybody in the country, every adult in the country who's at least 3 months out by January 1st. So he's told NIH, stop doing everything else, stop taking care of people in the hospital, stop treating cancer. I want you to go and boost everybody. Because he's basically very worried at this point by those types of numbers that he's seen in London and around the country.
Mhm.
This thing is spiking and it will probably overwhelm their hospital capacity very soon.
Right. Tim, if we are boosted, how likely are we to transmit Omicron as compared to those who have 2 vaccinations or are not vaccinated?
Again, most likely your transmission is down somewhat compared to those who are unboosted at this point. Just as, even if you're got just your 2 shots, then you still have some level of protection there and you're not going to transmit as much. Because remember what happens if you're vaccinated and you do get infected. Well, in the initial phases with Delta, we know that your viral load was as high as somebody who wasn't vaccinated. It tends to drop off fairly quickly. After 4 to 5 days, your infectiousness drops rapidly. Okay, so again, vaccinated people are probably going to be less likely to transmit to others. But during that initial period, we don't have the data yet on Omicron to know if their viral load is similar to the unvaccinated.
Right.
It's still too early on that. But I have no reason to believe that that may not be the case. So you should still take precautions, even if you're vaccinated, not to transmit further. And that's why masking is so critical.
Thank you. If boosted 3 months ago, should we get boosted again? If so, when? Kind of.
Unfortunately, I think that's going to be gated by CDC, to tell you the truth, in this country. There's not enough data really on what's going on at 3 months now. I've only seen one neutralization study looked at some samples and did find a decrease, but it may not have been enough of a decrease yet to basically allow infection. So, but my guess is as the studies come in, we probably will find that those boosters wane maybe a little more slowly than the original 2 doses did. But there will certainly be some waning with the boosters. And so, yes, we will probably need to get boosters again. Exactly when, I don't know right now. The data is not there to tell us. And again, we're going to be gated by what CDC is going to allow us to do anyway.
Thank you. Tim, is it true Hawaii is only 62% double vaccinated? And which data sources do you recommend we follow?
The data we have from Department of Health, which is the only data I'm really aware of, says 73% of the total population. Again, the extent to which that's true is an open question. We do know that they just did a substantial amount of work to reinstate the vaccine registry because they had kind of lost track of exactly what was going on. So I don't know that we have a totally clear picture right now. I have no reason to believe that Department of Health is trying to mislead us. I think it does seem likely. And we have really been pushing vaccine here. We've gotten a lot of doses into arms. And so I have no reason to disbelieve that. But at the same time, we've still got a lot of children who aren't vaccinated yet. And we've still got, I think they estimate 150,000 adults or whatever who are still not vaccinated. So those people could easily fill our hospitals basically if they contract this.
Tim, what is the max number of hospital beds our state can handle with complete and good care without importing healthcare workers?
The number I hear is 2,400, which is pretty much our capacity. Right now, my understanding is we're close to 2,300 because of a backlog of care basically associated with delayed care, people with cancer, people with other conditions that basically did not go in for treatment because the hospitals were filled with COVID patients. Okay. That is helping to fill our beds. Now, unfortunately, some of that could get forced out again. But that comes with a major opportunity cost because if we're not treating those people, their illness is going to get worse and worse and may eventually prove fatal. Okay, so we really need to avoid filling our hospital beds to the extent that we possibly can with COVID patients. And that means people need to take precautions. It's up to us. The leaders are doing very little at this point to slow things down. So I think it's really up to the people basically to take the appropriate measures.
Right. Everyone needs to take responsibility.
Exactly.
Tim, in your opinion, should UH Manoa fully reopen for in-person instruction for spring 2022?
I think it's too early to tell right now. I think we need to see what happens with this Omicron wave. We need to get a better handle on what actually happens in terms of severity and those who are vaccinated and previously infected, and get a clear clinical picture of exactly what's going on there. We also don't know how this wave is going to play out here in Hawaii, whether it rises and then falls, whether it rises and stays at a higher level. We don't know that at this point, and that's an open question.
Right. A lot of uncertainties that we're.
Yeah, well, all of us need to learn to live with uncertainty. The bottom line is that COVID is going to keep throwing curveballs at us. This is not the first time COVID's done this to us, right?
Right.
Everybody thought in July it's over, but we already knew Delta was coming if you were paying attention to other countries. Then, everybody, yeah, you can reopen, you can do everything for Christmas. Nope. Delta didn't, or, Omicron didn't like that idea. So COVID decided to intervene and play Scrooge.
Yeah. Tim, so on to the next question. While the major concern remains hospitalizations, there's an increasing amount of data indicating that some effects can linger well after infection. Can you tell us a bit about the risk of long COVID?
Long COVID is basically prolonged symptoms of one form or another in somebody who's been previously infected with COVID. It can follow serious infections and hospitalizations. It can also follow comparatively mild infections. The studies really vary in terms of how much long COVID they report, anywhere from 2 to 3% up to about 30%. And a lot of it depends on what they're defining as long COVID, what kind of symptoms they're looking for. But there is little question that at least in a substantial fraction of people, they may continue to have heart problems, for example, an elevated heart rate for an extended period of time. They may continue to fatigue easily for extended periods. They may actually have lung damage that literally will stay with them for the rest of their lives. Okay. We have not characterized that anywhere near as well as we need to. And I think that's really important to stress. And so it is an unknown at this point. It is a serious concern. There are people who definitely have long COVID who basically are still unable to walk up a flight of stairs. Or if they do, they walk up a flight of stairs and then they collapse into bed for the next 2 days. So, I mean, there are serious issues with this for some people. And we haven't characterized that. And that's why frankly, it's a real crapshoot. If you get COVID as to exactly what you're going to end up with. And we do not know the extent to which vaccines may also protect against that. Okay, that hasn't been characterized very well either. So I think there's so much we don't know there that my recommendation, don't get infected in the first place. Do everything you can to avoid that and to avoid it for your family members.
Very good advice. Tim, when we discuss COVID, quote unquote, vaccination, should we qualify it with a descriptor noting the level of vaccination, for example, quote unquote, with booster?
I actually think we should be moving to a definition of fully vaccinated, meaning with booster. There are a lot of people now in the public health community who are pushing for that. Because especially with Omicron now, we know that the transmission protection really drops substantially if you're not boosted. So boosting is really necessary to help to control community spread. And that's the reason, for example, in the UK, Boris Johnson is pushing so hard to get everybody boosted because he's trying to slow down the spread of Omicron in the UK, which, as you saw, is virtually a straight up sort of spread.
Yeah.
They're seeing the highest number of cases they've ever seen now.
Yeah. Tim, is there any data on pediatric vaccine effectiveness against Omicron? So with, regards to children 5 to 12 years old?
Nothing I've seen yet, and I wouldn't expect anything for some time because part of the problem is that CDC is not doing a very good job at the national level, basically, of tracking vaccinations, breakthrough infections, and things of that sort. And without that sort of data, it's very, very difficult for us to make those estimates of vaccine efficacy for children. My honest guess is that probably better data will come out of the UK first before we get any data in the United States, which is a real shame because, we used to have some of the best data systems in the world.
Yeah.
Now our data system, frankly, is one of the worst in the world in terms of tracking this. We get better data from Israel, we get better data from the UK, we get better data from Singapore.
Mhm.
And that's actually where we've learned most of what we need to know about Delta first and now Omicron. And South
Mhm.
Africa as well is contributing in a major way to our understanding of what's happening with Omicron, even though their situation is somewhat different than that in the Western countries.
Thank you. What are your thoughts of those looking at alternative treatments like ivermectin?
No evidence that they work. Uh, I'm a firm believer, stick with the mainstream docs. They know what they're doing. They've been
Mhm.
treating COVID for almost 2 years now.
Mhm.
They are exhausted. Please consider them in not getting yourself infected so that you basically don't have to burden them further. They're exhausted at this point.
Yeah.
The nurses are exhausted. All our healthcare providers are exhausted right now. But I would rely on them. They know how to treat this. They basically know what works. They know how to care for you. Relying on things like ivermectin and so on, for which there is absolutely no evidence that it actually works
Mhm.
effectively against COVID,
Mhm.
is a fool's game.
Yeah. Thank you, Tim. And, just a quick moment to thank all of our healthcare workers and frontline workers that, maybe we have some attendees today, just, a special shout out and thank you to all of you for getting us through this pandemic. Next question, Tim. Why do places like India and South Africa, where the vaccination rates are low, only see one wave of infections as compared to the second and third waves other countries are seeing?
It's a very good question. Uh, some of it may be just that their infection rate gets so high with previous variants that, what we're seeing may just be the tip of the iceberg in terms of reported cases in those places.
Mhm.
Certainly, I think that was the case in India. The reported deaths are believed to be underestimated by as much as a factor of 10. And if the reported deaths are underestimated, that the reported cases are almost certainly underestimated by a similar amount. So in fact, it may have been that the majority of the population got infected, and before Omicron, therefore had some immunity from that prior infection against getting reinfected. That's why everybody was surprised when South Africa, which, like I say, probably about 70% of South Africans, especially in Gauteng province, got infected in the previous Delta wave. So you
Mhm.
had a largely, quote, immune population where you should not have seen easy spread of this. But then Omicron came through and basically broke through that immune protection.
Mhm.
That's why Omicron has changed the game. But with Delta, that immune protection still held. So I think that's why we saw one big spike in India, then it came down. On the other hand, the UK, where they got careless and basically stopped taking measures to protect themselves, they were seeing an ongoing Delta wave at about 40, 50,000 cases a day for the last 2 months. And then Omicron came and just shot it up, to who knows where it's going to stop
Yeah.
at this point. Right now, the UK's problem is they're running out of test capacity, so they actually can't keep track of the cases. They're happening so quickly.
Tim, were the different monoclonal antibodies targeting different places in the spike protein or different places in the virus, like the RBD or other?
I think that it's a combination of, what's effective. And basically what they do is they look at large numbers of antibodies that are generated by people previously infected, and they find which ones seem to be effective
Mm.
at neutralizing the virus in one form or another. I'm not enough of a molecular biologist, and I don't track this closely enough to tell you exactly
Right.
which parts of the virus they're impacting. But fundamentally, obviously, at this point, my guess is they're probably more targeting spike proteins at this point, which is probably why we're having the problem right now.
Mm.
Because Omicron has mutated the spike so much
Mm.
that it starts. Basically, think of it as a locking key. Okay. Basically, your antibodies are a key that's trying to fit in the lock of the virus and block it. Okay. But if you change the shape of the lock itself, so the key doesn't fit it anymore, you
Mhm.
basically can't stop it. Okay. Because antibodies work basically by going in and blocking that receptor so it can't attach to cells.
I see.
But if you block it so the antibodies can't attach to it anymore, it can still attach to cells.
Mhm.
So that's fundamentally what's happening here. And So it again, I don't know. We could look up the gory details if people wanted
Right.
to, but I'm sure most of the people on this call do not want to see that.
Well,
Too
thank
much
you for that
information.
analogy, Tim, because that question went a bit over my head. So I really appreciate when you explain it like that. Makes sense.
Yeah, it's fun. It's fundamentally blocking the key from fitting in the lock.
Right.
That's what the immune escape is doing. So you can't stop it. Before you could go put the key in there and stop it, and then it can't attach. But now your key doesn't fit anymore, so too bad.
All right. Our next question is, what is your risk in an elevator in a high-rise condo?
Number one, make sure you're masked. If you are masked and you're not in the elevator for an extended period of time, your risk is probably comparatively low. Because basically, to get infected, you have to be exposed to a certain level of virus for a certain period of time.
Mm.
Okay. Now, hopefully, they've stepped up the ventilation in most of the elevators. Hopefully, they're limiting capacity in elevators. In our building, for example, there are no more than 4 people allowed in an elevator at a time. And if they don't have that restriction in your building, I would strongly recommend that they put it in.
Mm-hmm.
Because you do not want too many people in there. The more people are in there, the greater chance of exposure.
Mm-hmm.
But again, you're probably not in the elevator long enough if you are masked and masked with a reasonable quality mask to get an infectious dose. So you're probably okay. But again, don't get into packed elevators any more than you go into packed nightclubs.
Right. Tim, do we know the incubation period for Omicron?
We do not. There are some that are starting to think that there are preliminary indications that it may develop somewhat faster than the previous variants.
Mm-hmm.
That it may be just 2 or 3 days before people basically reach a fairly high viral load and start becoming symptomatic. But again, there are no epidemiological studies at this point that basically have determined that. So we really can't say. My guess is a month from now, we'll probably have an answer to that question. We did have answers to that question with Delta about 2 months after Delta came out. So like I said, another month, we probably will have an answer.
Thank you. And what do we know about how the Omicron variant is transmitted on surfaces or just from droplets? Is there any evidence Omicron can infect via our eyes?
I mean, there is certainly a biological possibility that an aerosolized virus like Omicron could infect through the eyes. I mean, one of the early symptoms actually was conjunctivitis with the earlier variants of COVID, which is, basically itching and redness of the eyes. So there is that possibility there. But that is probably not the main route of spread. The main route of spread is almost certainly through probably less droplets than aerosols. What people don't understand about aerosols is that they get into the air and they can linger there for hours. Okay. And it depends on the size of the droplet. Yes, big droplets drop to the ground very quickly. Those don't go very far. But the aerosolized stuff can stay and linger in the air for an extended period of time. Because the smaller it gets, and it gets smaller as it evaporates, okay, as the water in it evaporates, basically, the longer it can linger in the air. And that's why indoor places are dangerous, because it can build up over time. If you've got 10 people with COVID in a large group, basically breathing into the atmosphere, in a poorly ventilated place, that level of aerosol will build up over time, which increases your chances of getting an infectious dose. And that's why it's not just how long you spend in indoor spaces. It's basically whether you mask in those indoor spaces, how careful you are. And that's duration is important there. You don't spend, if you just run into the store and then come right out again, you're probably not having a problem. But if you go and you stay inside 20, 30 minutes, you may have a problem. So I think, remember the aerosols build up over time in the air if the place is poorly ventilated. And I will remind you, our early cluster reports here in Hawaii showed a lot of infections occurring in the kitchens of restaurants, which are probably some of the worst ventilated places around, as I'm sure any of the kitchen staff will tell you.
Right. Tim, what would you recommend the East-West Center do for the Indo-Pacific region to address the pandemic?
I think fundamentally, the center needs to get information out there. Although with that said, I think, most of the Pacific has actually done a pretty good job so far in terms of managing this. I mean, a lot of them have worked with quarantine requirements and have basically managed to remain virus free, which is, one of the reasons why they're, it's several Pacific jurisdictions who are the ones who can actually travel to New Zealand right now, them and the Australians, because they've managed to keep the virus levels exceedingly low. Whereas most of the rest of us, New Zealand won't let us anywhere near them with good reason. I don't blame them. I wouldn't let an American tell you the truth. We've got way, way, way too much COVID here. But I think, I think countries in Asia actually know what to do already, and they're generally doing it fairly well.
Mm-hmm.
If there's one thing we could do to help them, it's basically to promote expanded production of vaccines, and in particular, expanding vaccine production capacity. That is, we actually need to start thinking about working around intellectual property protections and start building production capacity in every country in the world. Every country in the world, for example, should have its own production capacity for mRNA vaccines. So that if we had that, then as soon as a new variant came out, we could develop, and typically it takes them less than a week to do this, develop the new mRNA primers that basically are needed to protect against that. Then there's usually a clinical trial period that takes 90 days or so.
Mm-hmm. Mm-hmm.
But once that was done, they could then immediately send that primer out to every factory in every country, and those countries could be producing them for themselves.
Mm-hmm.
And that, I think, would be one of the major things forward. In fact, I would go so far as to say probably the biggest failure that we've had on a global level to date is our failure to get vaccines out to the rest of the world.
Mm-hmm.
And it's been held back by intellectual property protections, by failure to address the needs of especially lower and middle income countries where vaccination rates are still like 6 to 10%.
Mm-hmm.
I mean, that's the real problem. And even the countries of Asia have had problems in getting access to vaccines in many cases. So I think one thing we could do there is promote more vaccine development and production
Mm-hmm.
on a global basis.
Right. Thank you. Tim, any comments about HIPAM, the Hawaii Pandemic Applied Modeling Work Group, COVID forecast on new cases by New Year's?
I think they're doing the best they can. I think it's challenging. Modelers are challenged with COVID in general, because, as we've noted, the virus changes quite a bit every few months.
Right.
Delta was a totally different virus than Omicron is.
Mm-hmm.
With Delta, immune escape wasn't really much of a problem. With Omicron, it is. So the vaccination status of your population, what fraction is vaccinated, what fraction is previously infected, becomes really important in making predictions. The other thing that makes it extremely difficult to predict things with COVID is human behavior. We don't know how to characterize, how do you characterize people going to parties? I mean, how do you characterize people going to restaurants in any quantitative way that you could actually build into a model? It's extremely difficult to do.
Right.
With that said, if you just fit an exponential to the current curve, it fits pretty well, and it's not a pretty picture.
Mm-hmm.
Basically, we'll probably be looking at 2,000 cases a day maybe by Christmas at this rate. I mean, it's growing very, very rapidly right now.
Yeah, scary.
We may actually start to run into problems in terms of our testing capacity, and so we may start missing cases because we already know what the lines for testing look like out there. They're massive.
Mm-hmm.
And so we definitely need to be opening more testing sites. We need to be making testing far more available to people.
Thank you. There is some concern that RATs are unable to detect Omicron, and there have been no peer-reviewed studies about this. Could you please share your thoughts on the use of rapid antigen tests for Omicron detection?
So far, there hasn't been any evidence that I've seen of the immune escape of Omicron basically negating the results of rapid antigen tests. There are some concerns that people are using them like a day or two in advance, and if Omicron does in fact spread more rapidly within the body, you really need to be using them immediately before you go into whatever activity you're testing for. There is definitely that concern. Certainly some of the PCR tests have been found to have problems with Omicron. There are literally hundreds of these tests. I'm aware of the FDA flagging 3 of them as problematic for Omicron detection. So I would not be surprised if that ends up being an issue with some of the rapid tests. But again, the FDA and the manufacturers need to really double and triple check that their tests can in fact pick up Omicron. At this point, there's no indication that they're not.
Thank you. Tim, are you submitting your findings to Hawaii government?
We've been trying. We're trying very, very hard, believe me. It's not my findings. It's basically just reporting on what the scientific community has learned in the last month, which is, again, I want to stress, preliminary, but it's also an incredible amount of information that we have learned about this variant in a very, very short period of time. So a lot of credit really needs to go to the scientific community, and especially to places like South Africa, the United Kingdom, Denmark, that are really generating excellent quality data sets that are giving us a lot of the information that I'm reporting today.
Next question. An unvaccinated person who recently got COVID and recovered tells me that she is immunized. This is frustrating. How long does natural immunity last, and what do we say to these people?
With Omicron, we don't have a good idea how long it will last. I would not be surprised if it's not good for more than a month or two, if even that. With immune escape, I mean, Omicron works around this. I mean, that's, like I say, the bulk of the population in South Africa was previously infected with Delta. And yet we saw this massive spike occur there. So, they're living in a dream world if they think that they're protected. And the other thing I want to stress, remember what I said about super immune? Those who got infected and then got vaxxed?
Right.
They have the strongest immunity of all. They are the most protected against infection, and also certainly most protected against severe illness. So what you really ought to tell her is that she can become super immune if she'll go and get vaxxed. That would be my recommendation.
Good answer. Tim, can we project the staying power, stamina, as the dominant variant for Omicron? Example given, will Omicron across the population burn out quickly?
We don't know yet. We don't have any examples of where it's burned out. Now, hopefully in South Africa, it seems to be on a downswing. We're going to have to watch that closely in the near future. And my guess would be after you're Omicron infected, you probably do have immune protection against Omicron going forward, because you have now been exposed basically to the spike proteins and the other proteins of Omicron itself. And so your immune response will adapt. That's why it's called the adaptive immune response. It basically adapts to the proteins that are presented to it. So your own body will do a great job probably of protecting you against Omicron in the future after you've been infected with it. But we don't want you to get infected in the first place. So, get boosted and avoid that. But I do think that we don't know how it's going to play out. Now, the other possibility, which some people are worried about, is that we could end up with a sort of oscillating situation where we get Delta and Omicron waves following, which is certainly possible. I mean, in the UK at this point, we do have parallel waves of Delta and Omicron. And we don't know yet, still too early to tell whether Delta will eventually get pushed out in the UK or not. It may. It's in London, it's on a bit of a downswing now compared to where it's been for the last couple of months. So maybe Omicron will force it out. But again, we don't know that at this point. And we have to see. And it could end up, you toggle back and forth, because Omicron can reach the people who are vaccinated or who are previously infected with Delta, whereas Delta can't reach those people. But then once their immunity starts to wane, Delta can start to get them again. So, I mean, it could end up with ongoing waves of both of these going forward. We just have to wait and see. Although I will say, so far, it looks to me like the evidence is that Omicron's going for the whole ball of wax. I mean, country after country, we're basically, it's up to the 70-80% level already. So my guess is it's probably going to squeeze Delta out, which is not a great thing because Omicron is worse than Delta, at least in terms of rate of spread. We don't know on severity yet.
Tim, is the supply of vaccine in Hawaii sufficient to give everyone a booster very soon?
Well, you'd have to refer that to Department of Health, but I suspect that it is. I don't think the US in general has much in terms of restrictions on vaccine supply. That's one thing that's good. Now, our supplies of effective monoclonal antibodies are extremely low. So Trovimab, which is one of the monoclonal antibodies that remains effective, I think we've only got 50,000 doses in the US and about 200,000 on order. There's going to be a very short supply of that for treatment over the next month or two. So I think that's going to be an issue. But on vaccines, I think we got plenty of vaccines. I don't think that's an issue. And I think if Hawaii runs short, they can probably get more from the federal government without any problem.
Good. And Tim, do you know how long the Pfizer booster lasts?
Again, we don't have any long-term data on that yet. And I think that will be a subject of intense study over the next several months. We do have some indications at 3 months that there's a reduction, but that comes from literally one study with, I think, about 10 people. So it's very early times in terms of actually knowing what it means in terms of how that immunity waves over time with the boosters. My guess is we'll probably get that data out of Israel before too long, because Israel has pretty much boosted everybody at this point, and the UK is in the process of boosting everybody. So between those two countries, I would say within the next 2 months, we will probably have a very clear picture of how immunity wanes with the boosters. So watch Israel and the UK. Those are the two places that'll probably answer that question for you.
Thank you. And Tim, do you know where we can purchase the 15-minute tests?
Basically Amazon, Walgreens, but they are in short supply now. I think that's a real issue. I think trying to find them on the store shelves around here is very, very difficult. I mean, I basically ordered some from Walgreens a couple weeks ago, and they did have some supply at that point in time, but again, I don't know right now. But bop around between the CVS site, the Walgreens site, Amazon, and you may be able to find something there.
Right. Thank you. Tim, just wanted to note that we're approaching about an hour and a half in, and we want to make sure that we respect your time and that of our attendees as well. We'll try to get in a few more questions. We know you have another appointment to get to, so we'll address probably a few more before we come to a close.
No, I'm happy to go to about 1:45 or so if people want.
Thank you. We really appreciate your time.
I know there's a lot of questions out there, and and people are hungry for information. I mean, that's why I'm rather disappointed that our leaders have done such a poor job, basically, of informing people on this.
Yeah, absolutely. This has been very eye-opening. I really do appreciate your time and expertise today. Okay, on to our next question. Are outdoor parties or football games okay to attend?
Outdoor parties, probably okay, but again, I would recommend keeping your distance. You don't want to be swapping air with people. Let's put it that way. You don't want to be in somebody's face a foot away from them and basically yelling at them. And if it's a very noisy outdoor party, chances increase that you will get up close and personal and could potentially transfer an infectious dose. So my recommendation, even if you're outdoors, keep your distance. Don't get too close to each other.
Right.
Even outdoors, distancing is a good idea.
Yeah.
Football games, again, I'm going to be really cautious there. I do not want to be in large crowds, even outdoors, especially in large crowds of people who are screaming their lungs out. That spreads stuff all over the place. I don't know if you've seen the videos of the plumes coming out from somebody who's screaming or whatever. I mean, it's pretty impressive.
Yeah.
That stuff can spread, 10, 20 feet easily.
Yeah.
And so, if you're in the stands with a whole bunch of people doing that, not a situation I put myself in. Let's put it that way.
Agreed. Pandemic or not, it doesn't sound like a very great place to be.
My recommendation: still wear your mask even if you're outdoors at the games.
Absolutely. Tim, is it possible that the short interval between the two vaccine doses might be responsible for their decreased effectiveness in contrast to the 6-month interval between the second dose and the booster?
Well, there's little question. I mean, the studies have shown that a longer duration between first and second dose basically does produce a stronger immune response. But even in those who had the longer period, there still is a waning. And I think, the waning is a natural thing. with coronaviruses. I mean, if you
Mhm.
actually look at the common cold coronaviruses, which have been, their immune function has been studied in the past. And typically what you get with them is you get 8 to 10 months of protection against reinfection, and then you start to get it again. That's why, there's a cold season,
Right.
because, people get infected, then they go a year, and then basically the virus comes around again, and they have the possibility of getting reinfected at that point.
Mm-hmm.
So I think that, it would not surprise that waning, I think, is a characteristic
Mm-hmm.
of what we're seeing with coronaviruses. So I'm not surprised to see it with the vaccines, and it definitely occurs with natural immunity as well.
Mm-hmm. Thank you. For the last 2 years, severe cases either meant death or long-term effects on the body. How would you characterize mild cases for those breakthrough cases that do happen?
I think the majority of them will probably be comparatively mild.
Mm,
We do, and by that I mean you probably won't have any problems breathing. I mean you'll have symptoms very similar to a cold. You probably won't have a whole lot of breathing. You probably won't have problems with your oxygen levels and so on. I think most cases will be mild like that. The
mhm,
people who have to worry, I think, are those of us who are older, whose immune systems are less well protected. As we saw, what I showed you, 69% of the breakthrough cases are in people over age 65.
mhm,
So
mhm.
there is a greater risk the older you get, because your immune system is getting weaker. It's less effective, basically, at keeping you from getting infected. It's
Right.
also less effective at dealing with the severity of the illness if you should start to develop a significant viral load, get
Mhm.
actual problems. But I think that the wild card here is long COVID, on which we don't have any answers at all.
Yeah.
And so I think, for most people, yes, probably if you're boosted, it'll probably be a relatively mild illness. Even if you've got 2 doses, it'll probably be
Mhm.
a mild illness. But if you've got an underlying condition, if you're
Mm,
obese, if you've got diabetes, if you've got high blood pressure, you're at elevated risk.
right.
And you really do not want to contract this thing, because you may end up not being one of the mild cases.
Right.
And especially for the elderly who have those other conditions, it is really critical that they take the measures necessary to protect themselves, and that their friends and family also take measures to protect them as well. I think I want to stress the shared responsibility component of this. We have a responsibility not to infect other people. Just
Mhm,
because we may get a mild illness does not mean that we can spread this virus to other people willy-nilly and not worry about the consequences for them.
mhm,
Because for
mhm.
them, it may end up being lethal. And
Right.
so please, take that social responsibility.
Absolutely. Just in the culture of where we live too in Hawaii, the past couple of years of this, I think I've been more concerned about my parents and the kupuna around me, more so than myself. And I think that's just a responsibility that we all hold, is taking care of each other as
And,
well.
I will stress it's especially critical here in Hawaii, because our population pyramid is pretty flat at the
Yeah.
upper ages.
Yeah.
We got a lot of old folks here in Hawaii.
We
That's
too.
the bottom line, including me. So, there's a whole bunch of us out there,
Yeah.
and that is a real concern and a real issue. And many of us are living with 80 and 90-year-old parents or grandparents,
Mhm.
and we really need to take the measures necessary to keep them safe.
Yes, absolutely. Tim, for the purpose of testing before attending social events, would you recommend people schedule a molecular PCR test, or do you feel rapid self-tests antigens sufficiently detects the Omicron variant?
My recommendation would probably be the rapid test. In fact, what I would recommend would be do a rapid test the day before, and then use your second rapid test, since they come in packages of 2.
Mhm,
Use your second rapid test 15 minutes before the event. Because what the rapid test is good at picking up is an infectious level of viral load.
mhm,
Your
mhm,
viral load is high to the level that you could be infectious. The rapid tests are very sensitive at picking that up.
mhm.
They're not good at getting the low levels. The PCR can pick up lower levels, but at those low levels, you're not infectious yet. Okay.
I see.
So again, my recommendation would be probably, day before, and then 15 minutes before the event or before visiting your kapuna, whatever,
Mhm.
And then at that point, you can be fairly sure. Nothing is a guarantee. I remind you of the Swiss cheese diagram. You need to take multiple layers
Yeah.
of protective measures basically to keep the infection from occurring. And of
Mhm.
course, make sure that the person you're visiting is boosted. I think that's really critical. If they're not boosted, stick them in the car and take them down and get them boosted. Offer them a ride
Right.
because, it's important on their side that they take the measures to protect themselves. It's also important on your side that you take the measures to not infect them.
Right. Absolutely. Tim, are false positives a common issue with these rapid tests?
Actually, the rapid tests, for the most part, are designed to produce very, very few false positives. In fact, the specificity is something that they look at very, very closely with rapid tests because they don't want to get a whole lot of false positives that freak people out.
Mhm.
So I think I think what they say with things like Binax now, I think they get about 1 in 2,000 false positives. So it's a comparatively low number.
Mhm.
But if you should test positive on that, you should get a PCR confirmation in any case. Contact your healthcare provider and get a PCR confirmation.
Right. Right. Any thoughts on the use of CO2 monitors to judge capacity within indoor spaces?
I would strongly recommend them. There are countries, I believe Belgium actually requires CO2 monitors in public spaces. And if it rises above a certain level, basically you're required to take measures to bring it back down.
Mhm. Mhm.
So certainly I think ventilation in general has been an underappreciated component
Mhm.
of protecting against these respiratory pathogens.
Mm.
I think that, things such as HEPA filters in offices, especially if you're talking about, for example, open office floor plans and things like this,
Mhm.
you probably should have HEPA filters pretty much set up around the office, basically to remove infectious virus that may get into the air.
I see.
Uh, People should be looking at their ventilation systems and doing what they can basically to improve the quality of the ventilation. For
Mhm.
example, at the center, I know we've improved the quality of the filters in our AC.
Yes.
So I think that, those are the types of measures that businesses should be taking, building owners should be taking,
Mhm.
and the state should step in, I think, and start regulating this, or,
Yeah.
start insisting on either CO2 monitoring in public spaces and improving ventilation if the results are poor,
Right.
or improvements in ventilation systems. Some
Mhm.
countries, I believe the UK is actually, I think it's Scotland, is actually now set up like a $25 million ventilation fund
Wow.
that businesses can apply to help them cover the cost basically of improving their ventilation systems.
Right. Yes, we are very fortunate, thanks to our facilities team at the East West Center and our COVID task force. They have really taken a close look. And thanks to your advice, Tim, we're fortunate to work in a place that cares for our health like that. Next question. I lead a COVID-19 working group for my organization, and this webinar has been hugely informative. Can you recommend other reoccurring briefings or resources that discuss COVID-19 issues?
Uh, Not off the top of my head, but I do know that there are presentations. For example, I watched a very good presentation on Omicron from the UC San Francisco Grand Rounds
Mhm.
that was posted on YouTube.
Mhm.
And so if you search for some of the briefings from some of the larger medical schools or public health schools, you may actually find quite a bit in the way of presentations that are being done on things like this. So, yeah, unfortunately, I don't think we have any regular sort of system of that here in Hawaii.
Yeah. I think that was a hint, Tim, to turn this into a regular series.
Please, I'm tired of drinking from the fire hose.
So we
Believe
have
me,
two
the
more
last
questions.
month has been day and night, just Omicron, Omicron, Omicron.
Yeah, definitely. We know you've been working around the clock and truly appreciate, everything you've put into this. But we have two more questions. Are you okay on time,
Yeah,
Tim? Can you address
do two
those?
more, and then we'll call it quits, and I can get a
Okay.
bathroom break before I go to my next meeting.
Are people who had a poor reaction to the first or second vaccine shot more or less likely to have a poor reaction to a booster shot?
That's difficult. I mean,
It depends on the person, I think.
yeah, I think it depends on the person. It depends on what the reaction was due to.
Yeah.
My recommendation would be talk to your physician
Mm-hmm.
about your reactions and about the problems you had.
Mm-hmm.
Uh, there certainly are people who do seem to have some reactions to the vaccines that it may activate another condition or it may create some problems there. So I think those people do need to be more cautious.
Yeah.
But they could also consider switching vaccines at that point. At this point, basically what we call heterologous, there's a big fancy word for you. Basically mixing and matching vaccines is pretty much an approved thing right
Yeah.
now. And in fact, if you get the J&J, we actually want you to get off the J&J and basically switch over to one of the mRNAs, switch to Pfizer or Moderna, because J&J is not very good. And Novavax is probably coming out before too long. So there'll be another
Mm-hmm.
one that seems to be showing pretty good effectiveness, although I don't know, I haven't seen any studies against Omicron for that yet.
Mm-hmm.
But there probably will be additional vaccines coming out in the next year or two. I should point out there are also new vaccines being developed in the rest of the world.
Mm-hmm.
Thailand is actually developing its own mRNA vaccine because they're tired of trying to get supplies from the rest of the world.
Mm-hmm.
So they're in trials right now. So we'll see how that works out. But yeah, you can switch the vaccines if necessary. But again, talk to your physician, I would say.
Mm-hmm.
They know your situation best and
Yes.
the likely thing that may have actually caused your reaction.
Mm-hmm. Right. Thank you. And last question. There's some speculation that due to the larger portions of populations being vaccinated, boosted, or previously infected create a larger source of hosts and may target them first by increased immune escape. Can you comment on this?
Well, I think the virus will continue to try to infect within whatever population it's in. So, yes, immune escape is certainly possible. But again, if you're vaccinated, number one, you're going to be keeping your duration of high viral load reduced, which means there will be less chance for evolution in your body, at least. It'll be substantially reduced over those who are unvaxxed, who will actually have higher viral loads for up to 2 weeks or so. Yours will probably last 4 or 5 days.
Mm-hmm.
So that will reduce the possibility that you will give rise to another mutant. But we can't rule it out. At
Mm-hmm.
some point, remember, there are billions of people in the world right now susceptible and likely in the next year or so to get infected with something like Omicron that is spreading so rapidly.
Mm-hmm.
And so there is a huge population out there generating possible mutants. So do not be surprised at some point if another escape mutant comes up. But
Mm-hmm.
again, that's where it's critical, I think, to have the scientific establishment that we have that is looking at these things, is identifying these problems. I remind you, the first the world heard of this virus, this particular variant, was November 24th,
Mm-hmm.
4 weeks ago, basically. Right? And in that time, we've learned an incredible amount. In
Mm-hmm.
that time, we have also had Pfizer and Moderna both getting to work on an Omicron specific vaccine.
Mm-hmm.
Now, that would be probably still 100 days out because they got to do the clinical trials, phase 1, phase 2, phase 3. But we can work pretty quickly against these things. And the hope is actually that we may find improved methodologies to even speed up that testing phase.
Mm-hmm.
Okay, there are people already thinking about ways that we could speed that testing phase up so that we don't have to go through the full 90 days.
Mm-hmm.
And we could, in fact, get vaccines out even faster than that. So I think that hopefully the situation will improve, but we're going to have to stay on our toes. As is very clear at this point, the virus isn't going to let us rest. It's going to keep coming at us. So
Mm-hmm.
there's a little embroidery I saw on Twitter the other day that says, "That which does not kill me mutates and tries again." And I think that that's probably not a bad description of what's going on with COVID right now.
Yeah.
Okay?
Yeah.
It keeps finding ways basically to keep spreading because that's what its job is.
Yeah.
But we know how to stop it. Even if it takes multiple layers of protection, we do have the means and the method basically to stop it at this point if we're willing to do it.
Mm-hmm.
I think
Mm-hmm.
that's the real challenge. The real challenge right now is the fatigue.
Yeah.
I think it's a fact that everybody is so tired of this. We're all tired of this.
Yeah.
We all wish we never heard the term COVID-19.
Yes. Mm-hmm.
But but the virus is the one calling the shots here, not us. Our wishes do not make the virus any less virulent or any less serious in terms of its ability to spread. So we just need to keep on our toes and keep doing what we can to stop it.
Absolutely.
And I will remind you, there's hope. Germany is actually now on the downswing. Okay. Japan has had 0 deaths just about every other day within the last week or so. So it is possible to control this thing. It may take more measures than we're willing to do here in the United States, but it is possible to control this.
Yep. Good to know that there's hope, and we do all need to take responsibility. So thank you for that reminder. Tim, just thank you so much, again, for sharing your time and expertise with us today. We truly appreciate your ongoing efforts to keep us safe and well-informed. Just wanted to take a moment to thank our marketing and events team for coordinating and supporting Tim and I behind the scenes today. Just mahalo, big mahalo to the team and everything that you do. To all of you that joined us today, thank you. Just a reminder that there is a recording that will be available on East West Center's YouTube channel for later viewing, and please feel free to share that with friends and family who may not have been able to join us. And in closing, from all of us at East West Center, we wish you all a safe, healthy, and joyous holiday season. Mahalo and aloha.